Hello, everybody. I'm Dr. Lisa Chappel, the Associate Dean of Family Nursing, and with me is Dr. Irma Jordan. Dr. Jordan, would you introduce yourself?
Hi, I'm Irma Jordan. I'm the Clinical Director for the FNP and Psych Mental Health programs here at Frontier.
Dr. Jordan and I will be presenting the wrap-up session for NP Week. This session will reflect on many of the key messages from the presentations that have been this week for FNU's 2017 virtual event for National Nurse Practitioner Week. You may be wondering how you can make a difference or what steps you could take to make a change, and we're going to talk about some of those.
So join us as we reflect on some of the key takeaways from this week of great presentations and the action steps you can take as a current or future nurse practitioner to make a difference in family care.
Our first presentation was delivered by Dr. Julie Marfeld, who's the Dean at Frontier Nursing University, and her opening session welcomed everyone to NP Week and provided a review of nurse practitioner statistics, including the types of nurse practitioners, locations of practice, and the need for growth. She also presented attributes of nurse practitioners as healthcare providers and concerns about access to health care. She reviewed scope of practice across the United States and discussed nurse-managed clinics. Dr. Jordan, Dr. Marfeld presented ways that nurse practitioners can answer the call. Would you review those?
I think that probably the takeaway for me on this presentation was her call to be present in our organizations, to be involved with organizations, to speak up in practice, both within your current practice, but in MP organizations, and then especially with your political representatives, because as we know, our practice um, uh, guidelines by the Board of Nursing really begins with politics at home.
Policy, advocacy, and scholarship in a DNP program. Dr. Baker provided a review of social justice as she teaches it in a course in the DNP program. She defined social justice and identified resources to be able to teach social justice. One of the interesting resources that she discussed was a book chapter in the required textbook for the course that presents an important review of literature about the components of social justice, such as social determinants of health, population ethics, and professional obligations. Dr. Baker addressed the challenges that students have who are clinical experts and challenges them to broaden their thought processes about social justice, not just as it applies to the individual patient, but populations of patients, policies, and then national practice. Dr. Jordan, Dr. Baker links social justice to knowledge from other courses. What other courses did she identify that contribute to the knowledge base for social justice?
I think some of them were kind of surprising for me. Uh, of course, evidence-based practice must address social justice, but even the epidemiology course that the DMP students take, biostats, um, and then the leadership course that is required in the DMP programs all serve to increase knowledge of social justice for the DMP student. Dr. Rachel Mack presented uh, her free CE program on FDA upscheduling of hydrocodone and the effect on nurse practitioners' pain management practices. This presentation by Dr. Mack is timely considering the opioid epidemic that we are currently facing. As early as 2013, the FDA recommended tighter regulation on hydrocodone combination medications. With this tighter regulation came the consequences of effective pain management, changes in APRN regulation to prescribe these medicines, and the development of more alternative therapies to treat pain. Dr. Mack identifies other consequences in her presentation. Dr. Chappel, would you care to speak to some of these?
Yes, Dr. Mack presented some important consequences in her presentation. One would be the increased number of referrals. A second would be the increase in healthcare costs for this population, and then how this affects physician regulation at the clinical site.
Dr. Joanne Keefe and Dr. Amber Littlefield presented a presentation on encouraging culturally competent care to the LGBT patients. This presentation focused on the specific needs of the LGBT community and how they might be met by the advanced practice nurse. I was particularly struck by the overall disparities for this population, things like decreased rates of insurance and preventative screenings, an increased rate of interpersonal violence, drug and alcohol abuse, and homelessness, and suicide. Medical conditions are also increased, things such as type 2 diabetes, coronary artery disease, stroke, arthritis, and increased IV rates and cancer rates, to name a few. These disparities increase exponentially in persons of color. Dr. Chappell, these health disparities are alarming. What were some of the confounding factors for these disparities?
Well, the existence of health disparities is really a multi focal problem with very complex situations. And some of the confounding factors identified in this presentation included lack of statewide protection, such as employment, housing, and public accommodations. It is true that same-sex activity is illegal in over 70 countries, some punishable by death. The lack of recognition of same-sex couples by employers for inclusion in healthcare insurance, and all of these issues can impede an LGBT person from seeking healthcare because they fear how they may be viewed in the healthcare setting. Dr. Nina Harris's presentation, Patient Care Back to Basics, highlighted the work of Nurse Maud Collin, who provided care to the poor and women of color in the South from 1920 to the 1970s. Miss Collin was a nurse midwife, and one of the very interesting things about this presentation is how she lived in and cared for the community that she served. Dr. Harris's presentation focused on cultural competency when providing care to communities of color and the vulnerable and underserved populations. She also provided interesting back to basic ideas for care and also dietary ideas that I found particularly interesting. Dr. Jordan, what did you think of Maud Collin as an exemplar?
You know, Dr. Chappell, as I looked at this presentation, I was particularly struck by Maud Callan and the work that she did. So often we think that we have to have all of the latest technological advantages, and in her community, back in the early 1920s up until the 1970s, she really had to take healthcare back to what do people need as their basic needs. And so she looked at things like water, just clean water, exercise, sleep, nutrition, and stress management. And I think Dr. Harris challenged us to look at the care we deliver and how we might make a difference in our care with even just such basic changes. Dr. Chappell presented her presentation on health disparities for African American men as illustrated by male prisoners. Her presentation was a review of health disparities of these men, um, and she presented with us the leading cause of death for this population. Her presentation brought forward the need to have an increased awareness and emphasis on the health history and examination. Dr. Chappell, as you think back on your presentation, do you have any advice for us today?
I do. As I said before, health disparities is a multi-complex situation, but I believe that we all have a role to play in addressing healthcare disparities. So I encourage each one of us to consider how they can participate in addressing healthcare disparities. It could be in your practice where you see minority patients or patients who do have health disparities. How would you address their care? Could you do a more focused physical exam and collect a more extensive history, which was one of the ways that I participated? Can you educate others about healthcare disparities and the populations that are affected and how you can care for those populations? Or could you participate in research that addresses healthcare disparities?
Dr. Dobroth also presented her presentation on the integration of mental health services into primary care. Dr. April Dobroth discussed the mental health crisis we are facing in the U.S., reviewed some statistics that were quite alarming, but even more so, she discussed the limited access to care in addressing the mental health crisis we are facing. Dr. Dobroth's DMP project, um, she created an integrated plan of care involving a crisis line, the primary care provider, and the mental health provider in a rural clinic. Uh, these changes were brought about by developing a prompt, structured manner to deal with a patient having a mental health crisis, and in particular, in an area of the country where obtaining mental health services can be difficult for many. Dr. Chappel, I was surprised by the outcome of this study. What do you find most surprising for the study outcomes?
First, I thought this was a very impressive study and was very interesting. Some of the outcomes that I thought were interesting was the increased patient satisfaction, the appropriate handling of crisis calls, and a reduction of the cost of care in the emergency room by having this structured access point for mental health crisis. Dr. Dobroth presented a model that could be replicated across the country. Dr. Kelly Delana presented the DMP helping provide right care to the LGBT community. Dr. Delana spoke to her DMP project. She identified the LGBT community as a population that is often discriminated or invisible as healthcare. Her passion for working for this population fostered a quality improvement project in pursuit of her DMP. She is a Frontier graduate. She described a tool that I thought was very interesting called the SOGI. The SOGI tool establishes a means to identify patients as gender or sexual minority through the collection of sexual orientation and gender identity information, and it helps guide the patient toward right care to avoid health disparities. Dr. Jordan, what health care disparities were identified in this presentation for the LBGT patients?
I think some of the things that a primary care provider needs to be aware of were the increased use of smoking, uh, increased drug use, coronary vascular disease, increased HIV and sexually transmitted infections. Uh, Depression is common in this group and with increased suicide rates. Also, obesity, increased stress, and then several different types of cancers.
Dr. Tanya Nicholson's presentation, improving the family's experience, every encounter matters. Dr. Nicholson talked about using current evidence and storytelling to guide providers in activities that can be used to enhance patient satisfaction and safety. She talks about effective communication, caring, and civility in the clinical setting. Dr. Nicholson used an experience from her personal life, from her family, that truly illustrated the importance of caring and how much caring can make to a patient and that patient's family by all of us, no matter what our particular job is in the healthcare setting, but how caring and the expression of caring toward that patient and their family can make a big difference. She talks a lot about incivility and some of the outcomes of incivility. Dr. Jordan, would you talk about those outcomes for a minute, please?
Yes, I think you can divide this up between the patient and then the healthcare provider. For the patient, they could have increased healthcare cost. They have decreased satisfaction with care, and there can even be decreased patient safety. I remember a saying that I heard one time that patients really don't care about the care you provide until you show them that you care. And I think that's so true for our patients. For providers, um, the incivility among providers can cause an increased loss of time to complete tasks. It results in increased absences by the healthcare provider, decreased satisfaction and productivity, and of course, a reduction in morale. Dr. Jane Esden gave us a presentation on breaking the cycle of ACEs, or so in her presentation, Dr. Esden helped us to understand the 7 categories for adverse childhood experiences, or ACEs, how these experiences affect brain development in the growing child, and the health risk behaviors and adverse adult health outcomes associated with ACEs. Dr. Chappel, I found the description of how APRNs can use primary, secondary, and tertiary prevention to reduce the burden of ACEs particularly interesting. Would you like to summarize those for us?
I think the use of primary, secondary, and tertiary prevention is very familiar to us as healthcare providers, and I really like the way that it describes how healthcare can be delivered. Primary prevention includes increased social awareness, providing anticipatory guidance, enrollment in community programs, and screening patients for ACEs. For secondary prevention, Dr. Eston identified the need to build trusting and open relationships to increase the opportunity for honest communication between healthcare providers and patients, and in being vigilant and looking for signs of abuse or neglect. And then tertiary care can focus on reducing the traumatic stress of ACEs by using the trauma toolkit for primary care and referrals for cognitive behavior therapy. Dr. Elena Pendergast's presentation, Delivering Hope, the Role of Reduction in Preparing Advanced Practice Nurses in Palliative and End-of-Life Care, was very interesting. Dr. Pendergast talked about the similarities between birth and death, which she says are striking. There's a sacredness in being at the presence of someone taking their first and last breath. The advocates for both insist they are natural processes that deliver hope, empower patients while avoiding distress. However, while embracing these concepts, palliative and end-of-life care have been stigmatized in the United States and is most evident in the training of healthcare providers. Dr. Pendergast presented death as a natural process and as palliative care as a specialty for advanced practice nurses. Dr. Jordan, how can advanced practice nurses answer the call for the need in palliative care?
I think one of the first things is to provide education to families. There are a lot of myths out there, a lot of concerns about what will happen to their loved one as they approach the end of life. I think they can also use their influence in leadership roles to advocate for their patients. And of course, at the national and local level, to make sure that all patients are given the opportunity to really have quality end of life care.
Dr. Lindsay Burson presented family-centered care in a rural school-based health center. Dr. Burson spoke to just what is patient-centered care. This care focuses on the patient's needs, respectful of patient values, and involving patients in the care process. For school-age children, this includes the family as an integral part of this care. It strives to promote a partnership between the family and the provider and building on family strengths and empowers them to make informed decisions. Dr. Jordan, can we do as providers to empower families to help their children reach their potential?
Dr. Chappell, one of the things that I found surprising was how many parents really don't have a good understanding of what normal childhood development is. I think we all would like that, or we strive to have our children meet milestones early, but there are so many that just understanding what the basic milestones are and how they apply to normal development is essential. By the APRN providers using the Bright Futures framework from the American Pediatric Association, this will help to improve developmental screening. It improves increased anticipatory guidance and decreases the unmet needs of the children by early identification of failure to meet these milestones. I would like to take a moment to thank you for attending our virtual MP Week here at Frontier. It has been a pleasure. I know I have learned a lot in listening to the presentations that were given, and I believe this gives us the charge to go forward to provide the type of care that all citizens should have.
I agree, Dr. Jordan. There's really a lot of challenges in these presentations and really pulls our attention to areas that we need to know more about and to really focus in delivering patient care or educating the future providers. So I hope you have a great Nurse Practitioner Week and thank you for joining us.
Thank you.